Hello. Healthcare in Japan looks very different from care in the United States. This is not surprising when you consider how different the rest of Japanese culture is from ours. Compare the architecture, the food, the written and spoken languages, and the mythologies of Japan to our own, and the differences are outstanding. In terms of healthcare, Japan has a social insurance system in which all citizens enroll and pay monthly premiums, and access to healthcare is universal across Japan. As of 2016, the monthly payment per person was $280, according to PBS Frontline from 2016. For this fee, the Japanese can go to any doctor or specialist for their care. They do so at 3 times the rate of other high-income countries like the USA. There are no wait lists nor appointments needed for routine checkups and services because doctors, clinics, and hospitals are privately owned and very abundant. Losing one's job doesn't mean losing health insurance in Japan. One is simply switched to community-based insurance, and the government picks up the tab for the poor and the disabled. Furthermore, it is forbidden to deny anyone based on pre-existing conditions. Costs for health care are tightly controlled by the Japanese Health Ministry. This governing body adjusts, sets, and publishes prices for every service imaginable every 2 years. This creates a complete transparency and reliability for the Japanese consumers. For example, MRIs can be purchased for $98, and a night in the hospital will set you back $10 or $90 for a private room. However, the strict prices are set so low that volume is necessary to avoid financial deficit for the private hospitals and doctors that comprise Japan's health system. In 2016, approximately 50% of hospitals were in danger of going into debt. So, as good as the Japanese health system sounds, it's not without its flaws. Nevertheless, the Japanese happily consume their health care in large quantities. Inpatient stays in Japan are longer than those of Americans, counting 23.3 days and 6.5 days respectively. That's Yang 2025. Japanese citizens love body scans and get them frequently. In fact, the Japanese are so satisfied with the system that they have the longest life expectancy and lowest infant mortality rates worldwide. PBS Frontline from 2016. Japan believes healthcare is a right, but in the United States, a capitalist economy is valued more than one's right to healthcare. Here, care is a privilege. If you can't comply with the system, you might be faced with exorbitant bills or no access to health care at all. Here, access to care is based on a mixed method system of private insurance and government programs. The government is a single payer in the system, as is the American citizen. Adding to the complexity of the U.S. health system, there is a fee-for-service reimbursement and value-based alternative payment methods. Mason et al., 2021. The simplicity of Japan's system is highlighted by the complexity of our own system. Access to care in America is also complicated. Most hospitals, clinics, and sites are privately owned. Americans purchase private insurance or enroll in employer-based insurance. Then there are also the government's contributions. Citizens over 65 years of age qualify for Medicare, a program in which the government is the single payer. There is also Medicaid for low-income and disabled individuals. Finally, the government offers insurance coverage for military employees and their families through the Department of Veteran Affairs. The CHIP program is for insuring children. There's the Indian Health Service for Native Americans and the Federal Employees Health Benefits for federal employees, Mason et al., 2021. With all of these options, one might think that Americans can easily access quality health care, and the truth is not far off. Only 10% of U.S. citizens are uninsured. 2/3 have private insurance, and the other third receives the single-payer government insurance. That's from Crash Course, 2015. But not all insurance is made the same, and these numbers say nothing about the quality of insurance in America. In 2010, President Barack Obama attempted to provide all Americans with affordable access to care with the Patient Protection and Affordable Care Act, the closest thing to universal health care that this country has ever seen. While the efficiency of the ACA is still being evaluated, America could adopt a proven method, that being the social insurance system of Japan, to achieve better health care access and outcomes. The Japanese have created a solution for the exorbitant costs of American health care. According to Potter, 2021, at 17% of the American gross domestic product, the U.S. spends the most on the worst health care. Earlier, I described how Japan's health ministry evaluates prices and publishes the cost of all health services that are easily afforded by the Japanese people. Again, the caveat lies in setting the prices too low for private care providers and hospitals, causing financial straits. The OECD from 2011 shows that U.S. falls behind other countries in life expectancy and leads all others in infant mortality rates among other wealthy countries. Also, these occurrences are higher among racial minorities and women of color. The opposite is true in Japan. As discussed earlier, America would see benefit in cost and outcomes by adopting the Japanese system. Finally, with no waiting lists, fast and affordable services, and a populace that's all in, the quality of Japan's public health is second to none. Though Americans disagree on fundamental ideas, universal health care is generally accepted. The debate lies in how much should a government get involved in a free market system to achieve effective, efficient, and fair public outcomes. Crash Course 2015. Like Japan, Canada, Cuba, Norway, and the United Kingdom, the United States should prioritize equitable and affordable health care with a preventative focus instead of profiting from illness and pain. The Japanese system works incredibly well for them. Every citizen is insured for about the same rate that Americans pay in insurance premiums. No citizen is ever turned away. No citizen has gone into ruinous debt over medical bills. The government sets the prices and publishes them, and they are affordable. Granted, the prices may have to go up to keep providers in business, but that happens every 2 years anyway. Want to go to the hospital? Got $10? Life expectancy and infant mortality rates are the best in Japan. And best of all, the Japanese love their easy, affordable system. I want America to love its system too. That's why I suggest adopting the Japan model. Thanks.